Assalamu alaikum guys. We're going to start now. Thank you guys for being here today. My name is Omar. I'm a fourth year medical student and I've been handling the CTV program this year. So who here likes to go for interviews? Like sit for interviews? No one should. Because interviews make you feel nervous, they make you feel bad. You spend the next few days thinking about what you should have said, what you should not have said. But the thing is, with some practice and preparation, you can nail any interview you sit for. And that's the plan today. Dr. Khalid, one of the best graduates this university has had. Mashallah, he got into the Cleveland Clinic recently for his residency. And he volunteered and he stepped up and just for the support of the people who are going to be applying soon for the match. So that's the aim for this workshop. We're going to be doing he's going to introduce some key concepts about the interviews and how to plan your trips and scheduling and all that. And there'll be some mock practice for students who want to do that. So yeah, without any further delay, I would like to call upon Dr. Khalid.
Assalamu alaikum. Thank you guys for coming today. I appreciate it. So, as Omar mentioned, we're going to be talking about basically the most important concepts to remember regarding residency interviews. And while our focus is going to be the US residency interviews, I'm pretty sure most of these points will apply to interviews anywhere else. So the way the workshop is going to be divided, there's going to be the first part, which is this talk that we're going to have for about an hour, and of course I'll leave time for questions, any questions that you guys might have afterwards. And then the second part is going to be mock interviews. And because, a bunch of people registered, 65 or more even registered for the workshop, I can't do mock interviews with everyone. So we're going to be doing the mock interviews with the interns and the graduates who said that they're considering applying for the match this year. For those of you who did that in the registration, I sent you an email with a list of the most commonly asked questions, and I hope you guys had time to go over that. If there are any other interns and grads here today who did not fill out the registration and want to practice, please let me know after the talk, because I could probably fit in 1 or 2 more interviews today. One more point before we continue. I saw some 5th years who filled out the survey and said that they are considering applying for the match this year. I would not recommend that. If you really want to practice and we have a spot, then definitely I'm willing to practice, but I would not recommend applying to the match during your internship. Wait until after your internship, after you get your letters of recommendation, after you get your diploma and ECFMG certificate, and then apply. And if you apply before you graduate, before your diploma, before your ECFMG certificate, that's really going to limit your options. So, the first thing I want to mention are the resources that you can use when applying for the match, especially when you want to focus on the interviews. These 2 books are really, they're wonderful, especially the Successful Match. We've got a lot of advice on interviews, the most commonly asked questions, how, examples of responses that you can use. And these series of videos by the University of Wisconsin were really, the best that I found regarding residency interviews. So, how you'll be selected for interviews, of course, this is the big, this is all the stuff that you'll have to do for your residency application. They'll look at your medical school, they'll look at your USMLE scores, transcripts, your personal statement, your US electives. Of course, the letters of recommendation are extremely important, extracurricular activities, everything basically that's in your CV. Now, the first thing that I want to mention is that you will receive a lot of rejections. You'll apply around September 15th. For us, it was September 15th. Most programs won't start looking at applications until the end of September, beginning of October, and you're going to receive a lot of rejections. This is, I'm not a pessimistic person. I'm the opposite. In fact, I like to be optimistic and encourage people, but I do want to be honest and as realistic as possible with you guys. And the truth of the matter is, most of the programs you will apply to will reject you for a variety of reasons. Many of them will reject you just because you're an IMG. Even some of the programs that do interview IMGs will reject you because you're coming from a country that they have no experience with. There are very few, unfortunately, there are very few Saudi graduates who are doing residency in the United States. And as opposed to people from like South America, people from India, like many programs have experience with graduates from these countries. They have very little experience with graduates from this part of the world, and the programs that do have experience with Saudi graduates are usually programs that take the sponsored, applicants, the people who have the sponsored spots. So you will get emails asking you if you're sponsored by SACM, the Saudi Arabian Cultural Mission, and if you're non-Saudi, then your response is going to be, no, I'm not sponsored, and you can expect to get a rejection after that. So you will get a lot of rejections, unfortunately, and this is fine. You want to prepare yourself for that. You don't want to let it bring you down. It's not really most of it doesn't have to do with the fact that it's a weakness in your application or something like that. Most of the time it's going to be because you're an IMG, or you got filtered out because you're coming from a country that they have little experience with. Now, on to the more positive side, let's focus on how you can maximize the number of invitations you do get. And the first thing is obviously having a strong application. You want to get those high USMLE scores to bypass any filter that programs are using. You want really strong letters of recommendation. You want US electives. A little bit of research on your CV won't hurt. Apply to many programs. This is the first step that you can do to counteract being filtered out. Again, just to try to be as realistic with you guys as possible, I'll tell you what I did. I applied to 99 programs. This is risky. I applied to 99 programs and I got 12 interviews. That's about a 10% interview rate. And alhamdulillah, my application isn't a weak one. And I'm not complaining. I was really happy with my interview season. I got some, alhamdulillah, very good competitive programs that I was not expecting to interview at. But at the same time, there were a lot of less competitive, IMG-friendly programs that sent me rejections. And very early on, like very quickly, in the beginning of October, just a lot of rejections. And again, a lot of this has to do with the fact that we're coming from a country that they have little to no experience with. So the reason why I only applied to 99, most other applicants this year probably applied to around 150, 170, 200 programs. That is what I would recommend. For me, I was focusing a lot on fellowship, because I'm applying to internal medicine, and I'm interested in oncology fellowship, like I'm dead set on oncology. And I was looking at the oncology fellowship matches of the residents from those programs. So, and then I picked like the best 90 programs or so that I could find that had the best oncology matches specifically. I feel like I was too focused on fellowship. I should have been a little more focused on, residency. Alhamdulillah, I matched, but like looking back at it, my philosophy was that if I didn't match in these 99 programs this year, I'll do, because I was doing research this year in the US, I'll do a second year of research, increase my, strengthen my CV, and get more invites the next year and match the next year. That was the way I was thinking about it. But with the way the interview season went and looking back at this, I realized that even if I had strengthened my CV a little more with another year of research and more publications, I don't think I would have gotten that many more invites. Because again, like, alhamdulillah, what I did was I divided the programs into like my top 45 choices, my middle 45 choices, and then my backup 10 programs that were like IMG friendly, very IMG friendly. I got a lot of interviews, alhamdulillah, from my top choices, a lot from my middle choices, some of like, again, competitive programs with like 1% IMG rate that I wasn't expecting interviews from, and then like none of my backup programs sent me interviews. And I realized that it wasn't a problem with my application, it was really that most of these programs were filtering me out. Now I'm pretty sure like more research, again, more publications, a stronger CV would always help. But really, the number one obstacle that we will face is being filtered out. And unfortunately, like until the reputation of Al Faisal reaches most of the US programs, I think that this will be a problem for the next few years. And the number one way you can combat that is to apply to many programs. Focus on your residency. Just get into residency in the US. That is really your number one goal. So apply to a lot of programs. Apply to 150, apply to 180, apply to more programs. And apply to IMG-friendly programs. Apply to like those you have a higher chance of getting interviews at. Having an address in the US. This is a factor that I wasn't expecting, but geography actually plays a role. Because I was doing research at Mayo, which is in the Midwest. I did not get any interviews in the South. Like no interviews in Texas, no interviews in Florida, nothing in Utah. I got one in Mississippi, and that was after I called the program, which I'm going to talk a little bit about later. But then there are applicants who were living in the South this year who got more interviews in the South. If you're living in the East Coast, you'll get more interviews in the East Coast. And the reason for this is because programs are used to applicants who cancel their interviews because they're too far away. American graduates, when they get like 15 interviews, they start canceling the interviews they don't want to go to, and usually those are the ones that will cost them a lot of money to travel to. So programs are used to people canceling because they don't want to make that trip. So if you're far away from the program, you're less likely to get an invite, and I mean if you're across the ocean, if you're here in Saudi, I mean that's even less likely to get an invite. So I would really recommend, if you can, to do something in the US this year, volunteering, research, work as like a medical scribe, a translator. There are many opportunities you can have to do something in the US, but really I feel like having a US address in your application will really increase your chances of getting interviews. Respond immediately to invites. A lot of programs will send out more invites than spots they have. So they might send out 250 invites for 200 spots, just like that in a wave. So my goal was to respond to every invite within 1 hour. Like I even changed my email notification on the phone so I knew it was an email. Like 1 hour, I need to have responded to the invite, and that's really what I would recommend. I had a friend who waited 3 hours he responded to an invite. 3 hours later, there was no spot. He had to be put on the wait list. He got it later, but for a few weeks he had no interview from that program. So respond immediately to invite. And the final thing that I would recommend is to contact programs and reach out to programs. What I did is towards the beginning of November, I started sending out emails. That was useless. No one, I got 2 rejections after that, but other than, no one really seemed to care much in responding to the emails. So what I did was I started calling. I called about 20 programs. Again, these were mostly from my top choices, because after I started getting invites at good places and I realized, this is clearly people are not seeing my application. Let me call the programs and let them see my application then, if this is the problem. So I called programs. I called about 20 programs. About 10 picked up. 2 or 3 of them said that they were full. Actually more, maybe around 4 said that they were full. All the spots are full. The wait list is full too. And this was, I think, because I started calling programs a little too late. I called them at the end of November. I would recommend, end of October, beginning of November, you start calling programs. Before Thanksgiving. I was doing it after Thanksgiving. So about 4 programs said that 10 programs responded. 4 of them said that they were full, completely full. Waitlist is full. No chance to get an interview. And of course, I'm talking with the coordinators, not the program directors. You don't want to bother the program directors. You call the program coordinators. So 6 people took my ERAS ID, my application ID. 3 of them sent me an invite almost within 24 hours. I called 3 p.m. today, 10 a.m. the next day, I have the invite in my inbox. And again, that kind of confirmed that these people were not seeing our applications. And this happened not just with me, this happened with a lot of our fellow applicants this year. I can tell you many people who got 3, 4 invites out of calling programs. So it is really important, and I think most of us started doing this too late. We discovered this too late. So call programs. I would again recommend end of October, beginning of November. Really, emails, I haven't heard of anyone who got an interview after emailing a program. You want to call and you want to leave your ID with them, and that's the best chance you have at getting someone to look at your application. So now you're starting to get invites. Hopefully, you're starting to get a little more. Most interviews will take place mid-October to mid-January. So application is mid-September. You'll start getting invites towards the end of September, beginning of October. Most of these interviews will take place in the middle of October to the middle of January. Now, usually what happens is towards the beginning of October, there's this huge wave of invites and rejections. More rejections than invites, but that's this first wave. Now what happens is towards the end of December, a lot of American students will start canceling, they've got 15, 20 invites and they don't want to travel to all of them. So they'll start canceling their interviews in January, that they have in January. You might get a second wave of interviews at this point. So I probably got around, 8 interviews in the first wave and 4 in the second wave. So there is a second wave that will come. Now the reason why I'm telling you this is when you get those invitations to interview at programs, they will give you a list of dates. I would recommend choosing the earliest date you can. You want to leave those dates in January as free as possible in anticipation of a potential second wave of invites that you might get. So I left all my interviews in January empty, all my days in January empty until that second wave, and filled it up with the second wave of invites. So again, try to front load your interviews as much as possible to leave January as empty as possible for future invitations. And again, usually these invites, because they're last minute invites, they might be like a week away. Like, okay, a spot opened up next week, can you make it? Scheduling will be through different programs and websites. There's ERAS, there's Thalamus, there's Interview Broker, email. Sometimes you might even have to do it over the phone. All of these are really easy to use. They're very user friendly, but you want to keep your own personal calendar too, because it might be hard to keep track of 4 or 5 different calendars that you have. So keep your own personal calendar and keep track of everything. You want to book flights and hotels in advance to get the lowest prices possible. I used Airbnbs honestly because they were 1/3, 1/4, even 1/5 of the price of hotel stays. You want to keep weather conditions in mind. You want to go, at least the night before, sometimes even 2 nights before. I can tell you that during my last interview in January, I went 2 nights before, and it was great that I did that because the day before the interview, all the flights got canceled in our area because of really bad snow and really bad weather conditions. So you want to keep that in mind, and it's happened. People have lost interviews because the planes couldn't fly. There's bad weather conditions. And that's something, again, you really want to keep in mind when scheduling your interviews, especially in the winter, in January. Bad weather conditions can really affect your travels. Okay, you want to keep these things. This is like a travel checklist. I'm not going to go over all of these things here, but these are things that you really want to take with you whenever you're traveling. You don't want to forget them. Your portfolio is important to take with you to the interview days. I would recommend keeping, your CV, your personal statement, maybe anything that you want programs to look at when you're interviewing. But definitely keep your CV and your personal statement. I've had interviewers who had not seen my CV and couldn't access it, so I gave them the hard copy of my CV during my interview. So now, before you go to the interview, you obviously want to prepare yourself. I would recommend, there's so many places you can find commonly asked questions, the books that I mentioned. We're working on the 2nd edition of the booklet, the Guide to U.S. Residency, and we're going to put, commonly asked interview questions there. So prepare your responses beforehand. What I did was I wrote down the responses that I wanted to say, and I practiced them a lot with my friends. You don't want to memorize it and recite it. You don't want to be robotic during the interview day. You want it to come a little more naturally. But in my opinion, I feel like it's really great to have those responses in the back of your mind. You feel more prepared. You feel more confident when you go to the interview day. Do mock interviews with your friends. Do them over Skype. Record yourself. You could record yourself practicing, responses just by yourself and play those back and see how you're doing. Research the programs very well. It always surprised me how very little some applicants knew about the program they were going to. They didn't even know what visas they offered. They didn't even know the name of the program director. I mean, this is a little too much. Know the program well before you go there. Do your research. Look at the program website. The program website is an amazing source of information about the program. Attend all the pre-interview dinners that you can. A lot of people stress out about the pre-interview dinners. Really, these are mainly for the applicants. They're not testing you. They're not interviewing you. I mean, there are the occasional people who get drunk and crazy, and that probably does get reported to the program and reflects negatively on the applicant. But usually, they're not assessing you during the pre-interview dinner. This is mostly for you to meet with the residents. It's usually only residents. You meet with the residents and you ask them questions about the program that you probably wouldn't want to ask the program director. You ask them about work hours, the workload, the stress. Is the program really very supportive of them? Is there, techniques to help residents with burnout? Those sort of things that are really important to you that you might not want to ask your interviewer or ask the program director during the interview day. And try exploring the hospital beforehand. I did this with most of the hospitals I interviewed at, is that I would go the night before to the hospital and figure out where we were going to meet up for the interviews the night before, so that the next day I could just walk straight to it. That really, helps because you don't want to be late for the interview day. So, you got invited, you traveled, you made it there. What are your goals during the interview day? Now, a lot of people will say, you know, if you make it to the interview day, that's it, you have the same chances as everyone else that's being interviewed there. I don't think that's necessarily true. I think just like how we as applicants, before we go to interview, we have these programs that we apply to. These are like our top choices, these are our middle choices, these are our backup choices. I think programs, especially big and competitive programs, will have the same thing with the applicants. They'll say like, usually a program will interview, like in terms of internal medicine at least, they'll interview about 300 applicants or so. So they'll say, you know, these are our top 100 applicants that we want based on their application. These are our middle 100, and these are our, you know, backup 100, or our lower 100. And I mean, regardless of, obviously if you do, or if the applicant does really well during the interview day, I'm sure that will boost up their ranking, their final ranking, before the rank order list submission. But I find it very hard for an applicant who's like in the bottom 100 to all of a sudden after the interview day, you know, impress them so much that he's in the top 50 now in the final ranking. It's difficult because again, the application still, you know, does play a role in your final ranking. They do consider that a lot. And you know, you have to keep in mind that a lot of these other people you're interviewing with are also pretty good at interviews. I mean, especially American graduates, they interviewed a lot for medical school. They, just like we're going around interviewing for residency, they've done that before for the medical schools. They've traveled around the country and interviewed at different places for medical school. And from what I've heard, that's usually a lot tougher actually than the residency interviews. So they know how to interview. Like they've done it before and they've succeeded. So I feel like a lot of people, they go in with this mentality that they really want to just impress the program director. They want to be like the most impressive applicant in the interview day and just really blow their mind, and definitely like they're going to get ranked high. I don't really think that's how it works most of the time. However, what I can see very possibly happening is an applicant who's in their top 50, for example, you know, before the interviews, they say, okay, this is like one of our top choices. We definitely are considering this person to match at a program. I can easily see that person dropping down to like 250 or 280 in the final ranking. And that's by committing a major mistake, a red flag. And there are examples of that. The best example is coming late to the interview day. If the interview day is supposed to start 7:30, and you know you come in 8:15, the program director's already introduced themselves and they're talking about the program. That's not good. You're not gonna, like, if they rank you, you're gonna be ranked at the bottom of the list. Doesn't matter what medical school you're coming from. Coming late is a major, major red flag. It's better to be an hour early than a minute late. And you'd be surprised at how many interviews I've been at where people come late. Like I've been to 12 interviews, probably 8 or 9. There's always someone who comes, you know, half an hour late, 15 minutes late, 20 minutes late. And that's like, it's a major red flag. Another red flag is being rude to anybody, being rude to fellow applicants, being rude to the coordinator. Looking at your phone when the program director is talking about the program or you know, orienting you to the program. There was this one interview that I was at, and there was this applicant. We were doing the tour of the hospital with the chief resident, and then we lost this applicant during the tour, and we were looking for her, and it turned out that she had done an elective at that hospital before, and she was going around looking for the people that she had met during the elective and saying hi to them, and you know, I'm back, and look at me, and so we lost her once, and then you know, we found her talking with some nurses. The chief resident tells her, you know, stay with us, and we were going, the chief resident's talking to us, and she's talking with another resident, like from anesthesia or something, while the chief resident is talking to us about the hospital. And then we go to the simulation lab, and then we lose her again because she went somewhere else to see some other, and the chief resident was getting legitimately frustrated. I can't believe I have to say this, but don't piss off the chief resident at the program you're interviewing at. It's that simple, but you know, every time you go to an interview day, you will find people who are making clear mistakes. You know, any program, regardless of whether you're one of their top choices or one of their middle choices, if a program is inviting you, they are really interested in you. It costs the program money to interview applicants. It takes a lot of their time, actually. They would not send you an invite if they were not seriously considering you, regardless of where they're going to rank you. They are seriously considering you. So really, the best thing that you can do is maintain that good impression and don't do any major mistakes. If you keep your good impression, you know, you're there on time, you're polite with everybody, you answer the questions well, you're fine. You did like 80% of what's required of you in the interview. Now, of course, the better the impression that you leave, you know, the higher your rank will go, regardless, even if it's a few spots. Again, you know, during the during the interview day, you might be in situations that are a little stressful. Like for example, you might be interviewing in a program that has a lot of other like American grads. You know, I've been in situations where I was the only IMG. You might be interviewing with some really, good grads from like really good schools. And even, not necessarily like, top medical schools, even if you're going to like a university hospital, you might find applicants interviewing from the medical school of that hospital, and the program director knows them, and the doctors are joking with them, and the residents are talking with them. That can be a little stressful if you'll feel like a stranger at the interview day. That's fine. Don't let that stress you out. First of all, you don't know how high they're considering you. Like, you don't know how highly they like your application. You might be one of their top choices without knowing it. Second of all, the best thing that you can do is leave a good impression and don't make any mistakes during the interview, so don't stress out. And third of all, you don't know, even if those applicants are their top choices from their own, the applicants from their own medical school are their top choices, you don't know that those applicants are going to rank that program number one. They might rank other programs number one and match at other programs. They might want to leave the city, they might want to leave the state. You talk to a lot of American graduates, they don't care about the reputation of the hospital or things like that, or fellowship matches or research. A lot of them really make the decision entirely based on location. Some of them might be sick of the city and want to move somewhere else. So don't let that stress you out. Regardless of who the other applicants are, don't stress out, don't start comparing yourself to them. Don't be one of those applicants who starts asking people about their USMLE scores and how many interviews did you get and where else are you interviewing. That's not nice. Don't do that. Don't worry about that. Don't stress yourself out. And again, back talking about this reminds me of a point that I wanted to mention. Talking about the number of interviews that you get. Yes, you want more interviews. Yes, the more interviews you have, the higher your chance of matching. But really don't compare yourself to other people, especially like in terms of number of interviews. And I see this happening a lot during the interview season where people say, oh, this person has 5 more interviews than me, this person, like, I know people who had 15 interviews and didn't match, and I know people who had 2 interviews and matched. Like, the number of interviews, again, the more interviews you have, the better. Obviously, you want to increase the number of your own interviews, but don't use other people's interview numbers as a baseline or as a comparison for yourself. The more interviews you have, the better. You want to try to get as many interviews as you can, but don't stress yourself out over other people having more interviews than you. At the end of the day, the quality of the interviews counts more than the quantity, and where you match, if you match, inshallah, is the most important thing. And finally, the last goal of the interview day, which you don't want to forget about, is to really assess the program. It's not just you want to go there to impress the program. What surprised me is actually how much the program wants to impress the applicants. So keep this in mind, look at the program. Really the number one, the ultimate goal of the interview day is to see, are you a good fit for the program? Will you like the program and will the program like you? So don't forget about that part of the interview day. Don't just focus too much on, yes, I need to impress them and leave a good impression, and forget about, well, did I like the residents? Did I like the program director? So now we're going to talk about dressing for the interview. A lot of people, have questions about this, and it's not as complicated as people make it out to be. It's not as complicated as people make it out to be. You want to dress professionally. You want to dress formally. Dark, solid colors are always good. Make sure your clothes are clean. Again, there are people who interview with splotches on their shirt. I don't know why, but they did it. There are people, clothes that are like too large, too narrow, too thin. Make sure your clothes fit you well. Make sure they're clean. You don't want your appearance to be flashy. You don't need that $1,000 suit. You don't need that, gold chain, that vest. Really, you don't want to stand out in terms of your appearance. You want to blend in with your appearance and stand out in terms of your performance. So you don't want to be remembered as being the person with a really big watch or being the applicant with a really fancy necklace. That's not how you want the program to remember you. So some tips, 3 tips for guys, 3 tips for girls. Trying to be fair here. I'm not the best person for fashion advice, but guys, easy on the cologne. I know here we like to wear cologne. I love cologne, but over there it's not necessarily the best. You don't want to be heavy on the cologne. They consider it irritating and insensitive if you're wearing a lot of cologne that other people can smell. 1 puff, the less the better. For girls, easy on the makeup and the jewelry. Again, this is a professional setting, and you want to present yourself professionally. Guys, a lot of guys asking, can I wear this color suit, brown suit, light gray suit, white suit? Just navy or dark gray. it's really, don't complicate it. It's super easy. Navy, dark gray, you're good. For girls, you want professional footwear, but comfortable footwear as well. You'll be walking a lot during the tours. You might walk outside, you'll go up several flights of stairs, definitely. Expect to walk for about 2 hours during each interview day. So you want something that you can comfortably walk with. You don't want to be that applicant who's walking down the stairs and trips and then everybody runs and tries to pick her up, and are you okay? And so choose something that you're comfortable with. Guys, a lot of questions about facial hair and beards. Keep it well maintained, well groomed, you're fine. It's not gonna really, like, I've seen, a lot of residents, a lot of even program directors with beards. It's fine, just as long as you look professional. You don't wanna look wild. You look professional, you're gonna be fine. Again, same thing for girls. A lot of questions about hijab. Choose a professional looking hijab, like a dark or solid color, like solid white, beige, black, gray, you're fine. Another tip that I'd have for the hijab is you want it that's also, you want the hijab that's secure. Like, I know this is something that we probably don't pay attention to here, but we see people who, like, fix the hijab every few minutes, fix the hair, secure the hijab a little more. We don't pay attention to that here, but that will probably be very distracting to an interviewer over there who's not used to that. Like, imagine if I'm, with my tie is loose and I'm fixing it every 3 minutes. So you might wonder, well, doesn't this person, like, fix your, like, secure it? It'll be distracting to the interviewer. It's the same thing with the hijab. This applies to any piece of clothing, actually. You don't want to fidget with your clothes or with anything during the interview day. The reason why I'm pointing out the hijab is because we might do that without realizing it, because we don't pay attention to that here. But they will notice that, and it will distract them. So, like a pin or the two, you've done it about hijabs. But you don't want to fidget with any piece of clothing or play around with any piece of clothing during the interview day. And again, this applies for guys as well. Don't play with your buttons or your watch. Don't fidget. That's nervous body language. It's distracting. You don't want to do that during the interview day. And really, like, a final point to mention about, like, the beard and the hijab. And people always ask about, like, discrimination. Is this going to affect us? We're Muslims. A lot of us are Arabs, or from Asia. Will this affect us negatively? For the most part, no. You will find a lot of Muslim residents from other religions and places from all over the world. Residents, doctors, in any of these programs you go to, you find a lot of residents with hijab, a lot of doctors with hijab, a lot of residents and doctors with beards. It's fine. In most programs, they won't really care much about that. As long as you're a professional person and you have the good qualities of a physician that they're looking for, that will be much more important to them than all of these other factors. The other thing is that, programs will know a lot about you before they send you the invite. They'll see your picture, they'll see your application. Like, I don't know, I'm pretty sure no one was looking at my application, with my name Khalid, coming from Saudi Arabia. My second language on my CV is Arabic, and I've got a beard in my picture. I was pretty sure no one was looking and saying, maybe he's a Buddhist. Like, it's pretty clear. Like, they'll know a lot about you before they send you the invite. So I do think that there might be some racial, like, bias and discrimination that prevents us from getting interviews. But the thing is, you won't get the interview to that program. So that's not something that you're going to have to worry about. And finally, if you do go to interview at the program and you feel like they are, like, discriminating against you, or they are, like, racist towards you, then you're better off not matching there, honestly. Like, if they can't accept that about you, then it's their loss, not yours. You're better off matching somewhere else. So again, you want a program that you can fit in with well. So don't worry about this at all. Really, this isn't something that's going to prevent you from getting into residency in the U.S. This is not something that I would worry about at all, really, at all. So the typical interview day. This varies from program to program, but the typical interview day is going to have, check-in in the morning, usually sometime around 7:30 or 7:15, breakfast, coffee. There's going to be an orientation by the program director. You'll have interviews, and this can vary, between 2 interviews to 10 interviews, depending on the program and the specialty that you're interviewing at. Internal medicine, we're sweet, we're nice. 2, 3 interviews, maximum 4 a day. You go for the surgical subspecialties, you're going to have like 8, 10, 12 interviews in a day, and I think it's ridiculous, but that's what they do. Again, if they're like 2 or 3 interviews, they're going to be 20, 30 minutes each. If you have 10 interviews, they're probably going to be 5 to 10 minutes each. Then you'll have some sort of lunch and tour of the hospital. Obviously, the lunch is the most important part, but the tour of the hospital is, I think, really the most boring. I mean, once you see 1 or 2 hospitals, you kind of really don't care. It's an hour long or 2 hours long, and you walk a lot. It's boring. Really, this is, in my opinion, the hardest part of the interview day is touring the hospital. So the interview styles obviously will vary depending on the person who's interviewing you, but most of the interviews will be one-on-one with a physician, and most of the interviews that I've been in were very conversational. Like, the doctor wasn't grilling me, the doctor wasn't really, trying super hard to test me. It was really just one-on-one, like, what are your goals, what do you want, why do you like internal medicine? It wasn't like an oral test, which is what I had been expecting. Like, they're gonna ask me questions and they're gonna be like assessing my response, and is this a good response, is this not so good? No, really, most of the time it was just like a conversation. Again, they just wanna get to know you a little better. Other styles, now, sometimes you do get the formal interviews where the interview is like very serious, asking you like classic interview questions. What are your strengths? What are your weaknesses? Weird stuff like that. And some of them might even like be taking notes and scoring you. It doesn't happen very often, but it happens, so don't let that stress you out. The one that I don't like is the one where the interviewer doesn't have any questions and says, ask me any questions that you have about the program, because then you have to come up with like 4 or 5 questions to ask about the program, which always sucks. Panel interviews, I had 1 panel interview. I haven't heard of any other applicant this year from our program, from our university, who had panel interviews. But these are not very common, but they do happen. Basically, it's when like 3 or 4 doctors are interviewing you at the same time. It's a little stressful, but you prepare for it mentally, and you're gonna be fine. Group interviews is the opposite, is when one doctor is interviewing multiple applicants at the same time. And then finally, in those programs where you're getting like 10 to 15 interviews a day, you might be interviewing with like non-physician employees, like secretaries and coordinators and nurses and stuff like that. So, let's focus on the common interview questions that you might get asked. Probably the most common one that I've gotten asked is, tell me about yourself. This is how they start the interview. Now, what you need to remember is that you have a lot of control over the interview, actually, more than you imagine, and that's by your responses. So when someone says, tell me about yourself, this is really an opportunity for you to focus on the points that you want to emphasize the most during your interview day. So my response was something like, okay, I was born and raised in the US. I grew up in Cincinnati, Ohio. Moved with my family about 10 years ago to Saudi Arabia. Did my high school and medical school there, but I've always been interested in coming back to the US to continue my training and my practice. I did my USMLEs. I did electives in the US, which were wonderful experiences because I did them in internal medicine, which is the residency that I'm applying for, and in oncology, which is the fellowship that I want to pursue after my residency. And I'm also really interested in research. I've worked on multiple projects as a student, and I'm currently working as a research trainee at the Mayo Clinic. And I'm really looking forward to starting my residency and moving on to the next stage of my life. I like this response because I feel like it tells them a lot about me. Really, it emphasizes some of the most important points that I want to emphasize, and it kind of guides the next question. So I know after I say something like that, I know that I can kind of expect a lot of their next questions that they're going to ask. Oh, how's studying in Saudi Arabia like? How's your medical school like? Why are you interested in internal medicine? Why oncology? What research have you worked on? What research are you working on now? Those are the things that I can expect, and those are the things that I've prepared responses to. Different people will tell you different things about, how to respond to this question. Some people will say, oh, don't mention anything on your CV. If they ask you, tell me about yourself. They know your CV, talk about your personal life. Well, first of all, they don't always check your CV. Probably a third of my people have not been through the people who interviewed me did not go through my application well enough. The other thing is that, I could talk about how many siblings I have and, how I finally got a cat because I left my family, my dad's allergic, and now I've got a cat, and, I don't think they really want to know that about you. Like, that's not probably their priority when they're considering hiring someone as a resident. And if they do want to know more about that stuff, they can ask me later, and I'm more than happy to answer questions about my family and questions about my hobbies. I'm prepared for those. But if you start off with this, then you kind of open the door for them to ask other questions that you might not have prepared answers for, or you might not really want to go into. So really, I feel like choose to talk about things that you want to go deeper in, that they will ask you, that you want to be asked more about. Why are you pursuing this specialty? Now, one advice that I would recommend in all your answers is to be positive rather than being negative. Don't be critical. So, for me, like, I don't like surgery. I can't see myself working as a surgeon, but I'm not going to say, well, I picked internal medicine because, I don't like surgery. It's too hard for me to deal with sick kids. OB-GYN has too much surgery in it. Like, that's not, they'll say, okay, he picked internal medicine because he doesn't like anything else. That's not true. You want to emphasize, I picked internal medicine because, I love the breadth of how wide it is. I love how we take care of the patient as a whole rather than focusing on specific diseases. I like how we can take care of patients in the inpatient and outpatient setting. I'm interested in oncology. This provides a route for oncology. You want to talk about why you like the specialty, not why you dislike other specialties. And this applies to all questions, actually, not just this. Usually, actually, the interview won't even start with this question. They'll start with, how are you doing? Don't say, well, it was a busy day. I got lost in traffic and I was almost late for the interview day. You tell them, if they ask you how you're doing, I'm doing great. I'm happy to be here. How's the weather like? You're coming from Saudi Arabia. Have you ever seen snow before? They'll say, I don't want to say something like, oh, I absolutely hate it. I can't stand the snow. They don't want someone who's going to complain about the weather 6 months every year. So try to be positive. Show them that you're a positive, enthusiastic, optimistic person. And this applies to most of your answers. So what difference did you notice between training in the US and training in KSA? For me, my go-to response was something like, oh, I noticed that residents in the US tend to have more autonomy and more responsibility. And this is true. Residents in the US are actually the primary caretakers of the patients, not the attendings, not the consultants. It's the residents who are the primary caretakers. This is something that I personally like, and it's something that I mentioned. Again, I'm not going to say, well, I don't really like how residents in Saudi Arabia don't have as much responsibility. I will say I like how residents here have more responsibility. It's the same message, but it delivers a different impression about you. Now, of course, if that's not something that you like about the U.S., if you actually prefer the Saudi system, then there are other responses that you can use, like research opportunities or anything. But try to focus on positive points that you like about the U.S. training. They might ask you, why are you pursuing a residency here in the U.S.? I would not recommend saying something like, oh, I'm a foreigner, it's very difficult for me to get residency in Saudi Arabia, I don't have the Canadian citizenship, so Canada's gone, I can't study, I don't know German, so Germany's gone. Focus on, and those are all true, those are all very valid points, but you want to focus on saying things like, well, I really like the opportunities in the U.S., there's so many more opportunities, more programs, the career, you can have a much more broader career, more academic opportunities and research opportunities. Those are the things that you want to focus on. You don't want to say, well, German is too hard and I'm not going to spend 3 years studying the language. Where do you see yourself in 5 to 10 years? You want, again, this is a goal that you have. What are your careers? What are your career goals after residency? What do you want to do? Do you want to stay here? Do you want to leave? Do you want to do research? Do you want to be more of an academic person? Do you want to go private practice? So you have your goals kind of set up. Even if you're not entirely sure, you can say that. Well, I'm not entirely sure, but at the moment I'm considering doing so and so and so. But I'm open to, during residency to other options, and I'll be considering all my options during residency. What are you looking for in a program? Again, this really depends on your goals and your priorities. I want, great quality of training. I want, a program that will offer me research opportunities, teaching opportunities. Of course, you want to be careful with this response. Even if you're looking for research opportunities, again, our number one goal is to match and to, start our careers. If you're at a community hospital that doesn't offer research, you don't want to tell them, well, I want to be studying, the novel molecular markers in cancer care. Be a little more realistic and try to fit more with the program. So, again, this depends on your goal. Like if you're surgical, if you're interested in a surgical subspecialty, you might want to say something like, I'd like more hands-on experience. And this is something that you should actually consider when you're talking with the residents as well. Do they let you work hands-on? A lot of programs will say, in the first year of residency, you're just doing the scut work. You're the one, moving the patients around, putting in the lines, putting in the catheter, and you don't really get to do much hands-on, procedural work. And that's something that you want to take into account. So these are the things that you want to mention. What are the positive points that you're looking for in a program? Interests outside of medicine, they'll ask you about your hobbies. They'll ask you, you will write them in the CV. I had one interview where, I had cooking in one of my hobbies in my CV. Literally, 80% of the interview was about cooking. It's unbelievable. He's like, this is how he started the interview. He's like, I've seen your application. I like it. I know enough about you. I want to know more about you personally. What dishes do you cook? What dishes do you like to cook? What's your favorite dish? What's the most difficult dish you have? Like, what about this cuisine? Indian cuisine, Thai, this and that. Like, It was fun, but I mean, it was very unexpected. The whole interview, like 80% of it was cooking, and then the last 5 minutes was, okay, do you have any questions for me about the program? That was the whole interview. That was it. I've heard of people who the whole interview was about, basketball, because they put basketball in their CV, soccer. I had a friend who put soccer in his CV, and it was because he played like once every 2 months or something like that. And the person started asking him, questions about, what team do you root for, and what, what is your favorite team? You do the European League, and the person didn't know how to answer. So don't put a hobby in your CV unless you're really willing to talk about it, and this is something that you know enough about to have a full 30-minute conversation about. On a side note, you might get Arab doctors interviewing you in the US, and don't speak in Arabic unless they speak to you in Arabic. Just because they're in Arab doesn't mean that they will want to speak with you. Again, they're trying to see if you can fit into the program, so they'll probably be testing your English as well. There are a lot. I had a Syrian doctor who started talking to me in Arabic. Fine, I was talking with him in Arabic too. It was actually our last interviews for both of us. So he was like, we're both sick of interviewing and all stuff like that. So we were talking about weird stuff. But don't talk about, just because the doctor's Arab or has an Arab name, don't start talking in Arabic unless they talk to you in Arabic. So tell me about an interesting case you saw, a mistake you made, a mistake you saw. These are a little difficult. You're gonna have to go through your memories and try to figure out some interesting case to mention during the interview. But the most important part about this is at the end of the case that you mentioned or the mistake, you always want to end it with something that you learned. This is what I learned. This is what I learned not to I learned to double check the patient's name. I learned to I learned how to research up to date for interesting diagnoses or new diagnoses. I learned how to do this. I learned how to communicate better. So always at the end you always want to end on a positive note with something that you learned from this case. So these were the most common questions that I've been asked. Now other questions. These are like less common, these are like classic interview questions that are less commonly asked. But they're a little difficult, so my opinion, I recommend preparing responses for them because you don't want to be caught off guard with one of these questions and not know how to answer it. What are your strengths? Another strategy that I would recommend when answering interview questions is use examples whenever you can. So, for example, I like to think of myself as a good team player, or I try to be a good team player. For example, in our lab, we have a resident, an internal medicine resident who does research with us, but because of his clinical duties, he can't always make it to the lab. So whenever he can't make it, I help him with his projects, and he's always told me that's something he's really appreciated. That's really different from just saying, well, I'm a good team player, and ending it at that. That kind of sounds a little arrogant, actually, too, which you don't want. So use examples whenever you can. What are your weaknesses? This is a little difficult question to answer. You don't want to pick something that's like a major flaw, like, well, I'm a cocaine addict, and that's not, or I'm lazy and I come late to work. The only reason I've heard of residents being fired for is coming late and not doing their responsibilities. So that's not like, again, coming late is a disaster. So that's not something that you want to bring to attention. And if it's a problem, fix it. Something that's not like a really major character flaw, like things like, I have difficulty, asking for help. I don't want to bother people even though I might need help. I have difficulty saying no to people, when I might end up having too much on my shoulders and a heavy workload. You also want to mention that you've, noticed this flaw and that you're working on it and you're improving. For me, my go-to response was, well, when I first entered medical school, I had to present to the first time in front of my class, and I was pretty nervous, and I spoke very quickly, and people had difficulty understanding me, and I realized that this is a problem that I have to work on. So I took every opportunity that I could to present and practice in front of my friends, practice in front of my families. By the end of medical school, I was able to deliver my valedictorian speech in front of hundreds of people. It's just something I would never expected myself to do in the first place. So I like it because it doesn't I haven't killed a patient because I can't present well. And it's something that I've noticed, and it's something that I've worked on and I've made progress with. So this is what you always end on a positive note. Even if they might ask you negative things like, oh, tell me a negative, what are your weaknesses of your medical school, or something negative. What are the positives and the negatives of your medical school? Always end on a positive note. Like, you know, for example, we might say, well, our medical school is still relatively young, its reputation hasn't reached the US, but I do feel like with so many students coming here to do electives and applying for residency and matching in residency, I feel like eventually more and more programs will know about our medical school. Even though it's a negative point, you start off with mentioning the negative point, always end on a positive note. Again, be positive. That positivity is really good. Having that positive attitude and that positive mentality really reflects very well on you. Again, they might ask you, what are the strengths of your medical school? And that's something that, you know, you can, like, oh, first of all, we study in English, which is something that shocks a lot of people. They don't realize that even though we're in Saudi Arabia, we study in English. They really, oh, really? Like a lot of people tell me, you speak English very well, or you know English, and yeah, they don't realize that we study in English here. Again, they have little to no experience with Saudi applicants. But many of the programs I've been to said, you are the first person we've ever interviewed from Saudi Arabia. So they have like no idea what our education system is like. So you tell them like, oh, we study in English. At Al Faisal, you know, we're affiliated with the largest tertiary care center in the Middle East. We have a lot of faculty from North America. We've got our curriculum is, you know, relatively similar to the North American curriculum. We get a lot of support for research and electives in the US and a lot of funding. And all of these are very true, very valid points. We have a lot of graduates who are already matched in the US and some great programs too. These are all very valid points and very, you know, points that really will leave a great impression. What was I going to say? There was something I was going to say. Yeah, you know, I've been to many places in the U.S., many medical schools in the U.S. I've met with a lot of international graduates from all over, from some of the most famous places and random places. Everyone complains about their medical school. Everyone complains about, you know, their residency program. Everyone complains about everything, really. Yes, we do have weaknesses in our medical school, but at the same time, we do have a lot of very valid strengths. And really, in terms of international medical schools, I think ours is one of the most supportive for students who are seeking residency in the U.S. and a country outside of our own. So I've talked to IMGs who've actually failed the year because they did a month elective in the US and their program in their medical school didn't want them to. Like they failed them a whole year just for doing a month elective. It's crazy. So this is something that I would always emphasize these points, and that really, I feel like, impressed a lot of program directors. So emphasize the strengths, and again, you don't want to be, like I keep saying, you don't want to be negative, you don't want to be critical, you don't want to complain too much. Even if they ask you about negatives, mention a truthful, honest, negative point, but end on a positive point. Again, remember, you are a product of this medical school. You are a product of this place. So if you start going on and on and on and complaining about all these things that you don't like, first of all, you're shooting yourself in the foot because this is where you're coming from. This is your education. Second of all, you you give off the impression that you're a nagger and a complainer. Third of all, they're going to think that this person is not loyal. You know, the books that I recommended, there's the red one, The Successful Match, that I really like. They have a lot of quotes and interviews with program directors, and one of them said that the first thing that I think of when a student complains about their medical school a lot is that this person is going to complain about my residency program the moment he leaves. So that's going to give an impression that you're not a loyal person. So even if asked about negatives, you can mention a negative, but always, like I said, whether it's a weakness, whether it's a negative point about, you know, your medical school, anything, whether it's a mistake that you made, always in the end, mention something positive, mention that it's being worked on, mention that it's something you're trying to fix. Always end on that positive note. Then you have these other weird questions. Describe the leadership role that you had, describe your teaching style, how do you cope with stress? This is a nice way to talk about your hobbies. If you wouldn't be a physician, what else could you be? Political questions. Take a safe stance. I know especially if some of us here are, from Syria, they might ask you about the Syrian situation. I would always recommend taking the humanitarian stance. It's really terrible what's happening. A lot of innocent people have been affected. A lot of people who don't have access to health care and lost their homes. And I really hope that, eventually we can have peace in the region. And the reason isn't necessarily because the person might have an opposing political view. It's because, when you go to the US, you realize people don't tend to talk about politics a lot in the workplace. They don't talk about religion. They don't talk about things that might be controversial and cause arguments. So you don't want to be that, you don't want to give off the impression that you're a person who's going to start having political debates in rounds. That's not something that they'll want. And this is actually, it's not necessarily, just in the Middle East. Like, this is changing a little bit in the US. I was really surprised at how political people are now when it comes to Trump. I've had, program directors literally say, oh, this, idiot in office is causing, again, I would recommend taking a safe stance, even like even if you don't like Trump and the program director doesn't like Trump, say something like, yeah, it's unfortunate. They might bring up the travel ban. If you have, if you're a Syrian and you're worried about the travel ban, what I would recommend is if you can get a visa, well, talk to a lawyer. Talk to a lawyer and have your response ready so that if somehow, some way, the issue of the ban comes up, you can say something like, well, I'm fortunate enough to be here now for the interview. I got the visa to come here for the interview, and I've talked with the lawyer, and we have a plan, and the lawyer's reassured me that should I match, I should be able to get my J1 or H1B visa. So that's not something that should hinder me or should affect me. Again, and then a positive response. Be prepared. The better prepared you are, the more positive your responses are, the better the impression you will leave. So, and again, don't get too political. Just say something like, I'm fortunate enough that I can be here despite the ban, and I've talked to a lawyer, and I've got my affairs arranged. Should I match? Play it safe, and again, always reflect the positive side of you. Medical questions, very rare. It's uncommon to get asked medical questions, but they do happen, and usually that's a negative factor about the program. If it's a program that's asking you medical questions, it's probably not the program you want to be at. These are programs that tend to be weak, and you might not have a lot of support, and they just want to be able to know that you won't kill a patient on your first week because you're not going to have enough supervision probably. So that's not, be prepared for them, but for the most part, almost no programs will ask you about will ask you medical questions. Then you get the unusual questions, things like, tell me a joke. If you were an animal, what animal could you be? If you had to write a biography, what would be the most important part? Like weird, random questions. Again, be relaxed. Don't say, oh, I don't know. Just think of a weird answer and move it along. Again, they just want to get to know you a little better. They're not testing you. They're not going to say, well, the joke wasn't funny. You're not going to match here. Don't worry about it too much. Another point that I'd like to mention, this is something that I've noticed, is that the more competitive the program is, the easier the interview day usually is. And even more interestingly is the more senior the doctor is, the easier the interview usually is. If you're, I've interviewed with chairmen and people who are previous program directors and chairmen and people who are CMOs and stuff like that. Amazing interviews, very relaxed, very weird. So we were talking about things like Wall Street Journal and Alexa from Amazon and smartwatches and horseback riding and stuff, weird stuff, amazing. I loved it, very interesting interviews because they kind of know what they're looking for. They know how to assess your personality, and they want you to be as relaxed as possible. So if you're looking at your, schedule for the interview day and you've got an interview with the chairman of the department, don't freak out. That's my experience, at least. That's going to probably be a really good interview for you. It's the younger, junior doctors that are not really so experienced with interviews that will ask you questions like, what are your strengths and what are your weaknesses? And then, at the end of any interview, the doctor's going to ask you, do you have any questions for me? So, you want to ask meaningful questions that show you've done your research, questions that are specific to the program, not just there are some general questions that you can ask what research opportunities do you have? How do you support residents who are seeking, job opportunities after they graduate? These are general questions, but I like to focus on specific questions, things like, well, I read about this, course that you have for your residents on your website. Can you tell me a little more about that? The program director mentioned this during the orientation. I'd like to know a little bit more about that. And of course, you don't want to ask questions that make it clear that you haven't done your research. You don't want to be asking the program director, well, do you offer H-1B visas? And the program director tells you, actually, if you checked out our website, you would know that we don't offer H-1B visas. It's actually written in bold. That's not a good question to ask. That will reflect negatively on you. So that, again, just shows how important it is to do your research before you go to the program. So, some tips and strategies, for the interview day. Your interview starts the moment you enter the city, not just the hospital, the city. You want to be on your best behavior. Don't crash into anybody. Be polite with the guards, the secretaries, everyone. With the fellow residents, the fellow applicants, everyone. You want, be on your best behavior. Again, you have to keep in mind that the only thing they know about you is from your CV and how you interact with them on that day. They don't know anything else about you. They haven't spent the last 6 years with you in medical school. They haven't attended rounds with you. They don't know anything about you other than what you show them that day. Be confident, be energetic, you know, have that passionate, enthusiastic attitude, smile a lot. What I like to do is I usually like to smile at the beginning of my answers because I know that as I'm talking, I'm going to forget to smile. So be positive again in your responses. Don't be negative. Nobody wants to be on the team and do rounds with someone who's going to be complaining half of the time. Be enthusiastic and positive and optimistic. Use examples whenever you can, as I mentioned. Always try to relate the answer to something that you will bring back to the program. Positive body language, positive posture, confident posture. You want to, again, play with the tone of your voice. You don't want to speak in a monotone the whole interview because that will be very boring. You want to, bring out that charisma a little bit. This is like probably the most important message I can deliver today. They will remember the impression you leave, not the words that you say. Yes, focus on your responses, practice them, but at the end of the day, remember it's the impression that you leave. Are you that energetic, enthusiastic, positive, hardworking person that they want or not? Don't forget to assess the program as well. You want to assess the quality of the training, the environment, resident happiness and well-being. They want to look at the program director and how the program director is like, because that actually reflects a lot about the culture of the program. Visas offered, this might be important if you want the J1 or the H1B, and of course, the city. A lot of American students will focus a lot, on the cities, like that's their primary thing. I would not recommend that for us, at least as IMGs. Just, for residency, just put your foot in the country. Just the best program that you can get for your future is what I would recommend. Then after that, you can try to look for the, Florida or a nice little California. But the one thing that I would actually really recommend most about the city is the safety, because there are some places in the U.S. that are not. So let's say, like we're talking about Baltimore and Detroit and Oakland. Those are not places those are places you probably get a gun to your head if you wanted to fill gas. So that's the only thing that I would recommend most about focusing on the city. Like, you want a city that's safe. You don't want to have to worry about your life every time you leave the hospital and go home and stuff like that. Finally, the thank you email, post-interview communication, highly recommended. There are people like classically they'll tell you need to send a written note in the mail with your signature. I think that's too much. We're in the 21st century now. Nobody wants 30 letters on their desk after every interview day. So just emails, I would highly recommend it, but keep in mind that it can hurt. If the program tells you that they discourage post-interview communication or it says so on their website, don't send an email. We want to make sure that your grammar is correct. You don't want to send a thank you email with a doctor's name spelled incorrectly. You don't want to send, you don't want to have too many spelling mistakes in your thank you email. Perfect grammar, perfect spelling. Try to include something specific. This is a nice little tip. Try to include something specific from your interview in that email so they can remember you by. You don't want that vanilla, thank you, I really had fun during the interview day and it was great meeting you, yada, yada, yada. This is like an example that during one of my interviews with the program director, we talked about, shisha, which they call hookah over there. So I said that during the email, I mentioned I really enjoyed our discussion about the health effects of hookah. That's something that's going to stick in his mind. He's going to remember that about me. Send the email within like 24 to 48 hours after the interview day. You don't want to send it like 2 weeks later. That's weird. And again, indicate your interest in the program, and most doctors will not respond. That's fine. That's not a negative sign. And it's not a positive sign if they respond either, by the way. There are programs that have responded to people very positively saying, oh, you're an excellent applicant. There are programs that have even reached out to applicants afterwards, called them, emailed them, telling them, you're one of our top choices, rank us high, and didn't rank them, and they didn't match there. So, you can't always judge based on how programs communicate with you what your ranking is going to be. So if it's fine if the doctors don't respond. I really liked it when doctors responded. I felt like that kind of reflected positively on the program. These are people, if they're responding to my emails now, they're probably more likely to respond when I'm a resident. But again, it's not a big factor really to consider. And don't worry if they don't respond. Most of them will not. I hope that was useful. Thank you very much. If you have any questions or would like to reach out, I'm happy to answer questions now, but if you'd ever like to reach out in the future, this is my personal email. My Faisal email is probably going to be closing soon. I'm surprised it hasn't closed yet. But if you want to reach out to me, you can through my personal email. Does anybody have any questions now? I'm happy to answer. Yes, go ahead.
When you mentioned calling the coordinators at the What exactly do you mean by that? Do you just bluntly say, this is my ERAS ID, look at my application?
No. Again, you want to be you want to remember that you're communicating with the program directly now when you're calling the program coordinator. So again, best behavior. So what I would my call would go something like, I'm sorry to bother you. I know you must be very busy now, but I'm really interested in your program. I haven't heard back yet, so I'm wondering, do you still have interview spots available? And I just wanted to express my interest in your program if you do have any spots available. Again, about 4 of them said, no, we're done. No spots. Sorry, we're filled. The wait list is filled. And then I'd ask, is there a wait list? The wait list is filled. Some of them would say something like, yeah, sure. Tell me your ERAS ID, and I will take a look, or I'll give it to the program director and transfer that to the program director. And then I tell them my ERAS ID. Now, one of the hospitals that I called was a hospital that I did an elective at, so they hadn't sent me an invite, so I called them and I told them, I've done an elective and I'm really interested. She's like, oh, you did an elective here, fine. Let me get your ID and I'll give it to the program director. And the next day I had the invite. So that's how, again, you want to be polite, you want to be respectful, you don't want to be too pushy, you don't want to call 50 times. They don't want someone who's annoying. I'm interested in your program, I haven't heard back, so I was wondering, do you still have any interview spots available? And could I give you my ID if you take it? Some programs would say, some of them would say, we're still sending invites, but we don't take IDs. There are some people who say that. The coordinators say, we have no influence, we can't take IDs, we won't take IDs. They'll say, we do have spots, we're still sending out invites, but we don't take IDs. I think one program said that to me. You don't lose anything by trying, right? I mean, what's the worst that can happen? You don't get an invite from a program that didn't invite you, Yes?
You mentioned that sometimes they may ask you about the ban or something. But my question, how do they know that you are Syrian or you are from...
Good point, that's a good question. So, in the ERAS application, you will state where you are born and your visa requirements. So, if you're born in Saudi Arabia, then they're not going to know that you're Syrian. But they will ask you. They've asked me, by the way. Even though I was born in the US, they've asked me, are you originally Saudi? Where are you from? And I tell them, no, I'm Syrian. So, they might ask you if you're Saudi. If you were born in Syria, then they will know. They'll know that you're Syrian. So what they'll see is that you were born in Syria and that you require a visa. So they'll see that. If there are people who have a TPS, so they'll say that they don't require a visa. There are many different visa options that you have, but if they see that you were born in Syria and that you require the visa, then that will obviously trigger a question. And if they see that you're born in Saudi Arabia, they'll ask you, are you Saudi? They're probably interested in that sponsorship money. And then you'll tell them, no, I'm Syrian, and then that's...
Okay, that leads to the next question.
Sure.
Do you think those who have European passports or Canadian have advantage over ours? I understand that Americans don't need a visa, but for European, they will respond for the visa question by yes, I need a visa.
A passport. First of all, if you have a Canadian passport, that might not be an advantage, actually. Canadians are limited at how many, I think there's 115 J1 visas that Canada will allow for the US. I think 115 or 120 a year, 100 total. So if you're a Canadian, you're actually at risk of potentially not getting a J1 visa. If you are Canadian, they might ask you about that actually. You're a Canadian, there's a risk you might not get a J1 visa. You'll tell them something like, yes, I'll apply for the statement of need the moment I know where I'm matching. Again, within that 1 hour. As soon as I know where I'm matching, I'm starting to work on my statement of need for the J1 visa. And just in case I can't get it, I do have another nationality that I could use, or another country that I could get my J1 statement of need from. So that's something thank you for bringing it up. That's important because I do know some people have Canadian citizenships. So that's actually, Canadian citizenship is not necessarily a positive point. Now, having a European passport over an Arab passport, I don't think it'll help much in terms of the program. It might help you with the visa maybe, but the program itself, if you studied in Europe, that's a different thing.
No.
But I mean, we're all studying here, so it's not going to be that much of an advantage. The only advantage it would have is if it's not from a country that, it would be over a country that's banned, of course. One more?
No.
Sure, go ahead.
Do you think that step 3 will increase your probability of matching?
Good question. Step 3. If you have good step 1 and step 2 scores, it will only help a little bit. And if you get a low score in step 3, it'll actually hurt you. If you have a low step 1 or step 2 score and you want to boost your application, then yes, it will help. If you want the H-1B visa, then you need to have the step 3. Any questions over here first before we go back to the guys? Okay.
I had a question. You mentioned the US address.
Yeah.
Does that even apply if I have like a distant family member and I can use their address?
I know people who've done that. Yeah. I know, and I think it helped them.
I see.
And you mentioned after the interviews you re-rank your programs?
No, you don't re-rank. What happens is, you know, this is like your own mental ranking, right? Your own preliminary, like I had my own document of all the programs that I applied to before that I kind of ranked according to, you know, fellowship matches, the reputation of the hospital, stuff like that. But there's only one ranking and that's at the end. I do think that some programs have a similar sort of, you know, preliminary ranking before the actual ranking. Like they'll say, okay, you know, this person's coming from, you know, this top medical school here in the US, he's definitely gonna be one of our top choices. And this person's coming from, he's an IMG, he's probably going to be one of our middle choices. So they probably do have, you know, some sort of, but there's no official ranking until the end, after the interviews and everything. That's the only time that the actual ranking happens. This is like some sort of mental, you know, ranking I'm talking about.
But I meant you as an applicant.
Yeah.
Do you rank the programs again after your interview, or you don't?
You only rank them once, after you interview.
After your interview?
Yeah, that's the only time you rank programs. That's the only like official rank is after you interview. You don't, you know, you don't rank, there's no ranking before interviews. That was just like, I'm saying, like your own personal list, basically, is what I was talking about. Yes?
Doing electives in the same hospital you're applying to, how much does it help?
Helps a lot. Helps a lot. I can tell you one of the really competitive places that I applied to that has like a 1% IMG rate. I only got an interview there because I did an elective there. And I called them. That was one of the programs that I called. Told them I did an elective. I wasn't expecting, honestly, to get the interview, but after I got interviews at other really good places, I was like, it's not going to hurt. Might as well try. And I got it. So that definitely does help. There are other ones that like absolutely almost never take. I did one at, you know, like one of these university hospitals that doesn't, like never takes IMGs, and they had like rejection, one of the harshest rejections, like very early on, your application has been declined, thank you. Like everyone, and all the IMGs that I know got it in the same day. It wasn't just me, everyone got it. Like it was very clear they had filtered us all out. Same day they sent us all the rejection. And that was a program that was a place that I did an elective at. Now, a mistake that I made during my application is that I didn't communicate enough with the program administration, whether it's a director or coordinator or whatever, during my electives. This is a mistake that I made, and I would recommend that you actually, like, you know, alhamdulillah, I ended up matching in the hospital. I actually did an elective at the Cleveland Clinic, and I matched it, but I didn't talk to the program director then, and that's something, or anyone in the administration, and you know, alhamdulillah, it worked out for me, but that's a risk. When you do electives, I do recommend, you know, asking around and saying, can I talk to anybody about the hospital, about the residency program? I'm interested, I want to express my interest. That's definitely something that I would recommend, and it helps.
And
It helps.
during the elective?
During the elective.
That's the question, is it easy to reach the program director?
Most of the times, no. Most of the time, program directors will not meet with students. They will refer you usually to an associate program director.
Associate is good, right?
Associate, yeah, of course, associate is good, absolutely. At least associate, you know, will remember you. And they'll give you advice. Like I met with an associate program director at another hospital that I did an elective at, and he gave me a lot of really good advice. Yeah.